we will be moving right along. I'll welcome Danielle Tong right back to the stage and introduce our Deputy Director, Amanda Zabala. They'll talk about where we're headed and also where we've been. Amanda will walk us through the last 10 years of what infant mortality has looked like in Columbus, how far we've come, the lessons we've learned, as well as the challenges we've had. And then Danielle will share a look ahead at what's next for CelebrateOne and how we will continue to move the work forward and fight infant mortality. So put your hands together for Danielle and Amanda. Thank you.
All right. Are we sitting or are we standing?
I was planning on standing.
I'm kind of a pacer, so I think we'll stay standing. You can sit if you want. I'll just keep walking in front of you. All right. Back in 2014, the Greater Columbus Infant Mortality Task Force came together to solve a very important problem, the problem of infant mortality. And one of the recommendations they made was to establish a coordinated community-wide response. And that came to be in CelebrateOne. At that point, the goal was to reduce the infant mortality rate to 6 deaths in every 1,000 live births and to cut the disparity gap in half. We had so much engagement, so many community partners that wanted to see this work happen, and so much progress that between the years of 2014 and 2019, we saw a lot of progress. And then the year of 2020 emerged. We all know what happened that year. And the world changed for us. The way that we access our groceries changed. The way that we access childcare changed. The way that we go to work, the way that we earn a living, all of those things were different. And we saw that impact our infant mortality rates. In 1 year, we went from a rate of 6.8 all the way up to a rate of 10.2 in 1 year. And that was gut-wrenching for those of us within the work, for those of us watching along the sidelines, for those of us with our own kids at home. That was gut-wrenching.
It really was. You know, to see in such a short time frame this dramatic increase, it was just tragic. We went from losing 118 babies in 2020 to losing 140 the very next year. And these outcomes weren't evenly distributed. In fact, these outcomes have never been evenly distributed. In Franklin County, our Black babies are dying at a rate of at least twice, sometimes 3 times that of our white babies, and they have been for as far back as our data go. And during the pandemic, these disparities only widened. While we saw the overall infant mortality rate increase, the white infant mortality rate went from 4.5 to 4.9, representing a 4% increase, or 9% increase, I'm sorry. But our Black infant mortality rate went up 45%. 45% in 1 year. And we saw this very similar thing in our preterm birth rates as well. Our white preterm birth rate went up about 4%, but our Black preterm birth rate went up 15%. Now, COVID did a lot of things. It really highlighted the existing racial disparities, the existing racial inequities that we have always known to exist. And it's challenging to talk about, right? Like, we went through all of this together, but we did learn a lot, right? We learned that there's differential access to resources. We learned a lot about infection rates and outcomes. We learned about the necessity for targeted resources and services. And at the same time, while we were dealing with this deadly virus, we were also dealing with a second pandemic. We were dealing with the pain and devastation that came about from the public murder of George Floyd. But after this came a racial reckoning. After this, we realized as a society that we had to deal with the consequences of systemic racism. And as a city and as a county, we declared racism a public health crisis. We said we recognize that racism-related stress is directly linked to physical and mental health outcomes. Things like hypertension and depression and advanced biological aging. And we know that all of these have profound effects on our birth outcomes. Now, racism is profound. It's foundational to our country's history. And it continues to impact our policies and our practices despite our best intentions. Now, Dr. Kamara Phyllis-Jones, a world-renowned public health leader and epidemiologist, has said that we shouldn't be asking if racism is operating here, but how. And so as we're doing this work, we have to ask some really hard questions. Like, how is racism impacting our past and our current policies that are affecting our birthing people and pregnant women? How is racism impacting our funding, our ability to fund initiatives that reach the people with the worst outcomes? This work is hard. Infant mortality is considered an adaptive challenge, and it's very complex with multiple intersecting factors. And so we have to be constantly learning. We have to be willing to ask the hard questions, and we have to be willing to get to those hard answers.
So in 2021, the community came together to take this lens to look at our CelebrateOne strategic plan. It said a lot of the things that we saw from the 2014 task force, but it also acknowledged that racism was a driver of infant death. That strategic plan highlighted for us that we need to look at better coordinated resources for our families, improve prenatal care access, improve preconception health, and community-informed strategies to prevent sleep-related deaths. Since then, our field has continued to evolve to know that we have to talk about maternal health as well. And in addition to that, maternal mental health, and that it is our responsibility to pursue and root out racism in each of the processes that our babies and our families encounter throughout their life course. Columbus Public Health convenes a committee, a group that takes a look at infant deaths that happen here in Central Ohio. They actually convene multiples of these. And these groups look at cases of infant death, and they actually essentially tell us if our community had done these things better, these babies would have lived. And they tell us a lot of the same things. So now we have a trend. We have our 2014 task force recommendations, we have our strategic plan, and we have our reports from Columbus Public Health that tell us prenatal care, coordination of social determinants of health, preconception health, a community-based response to sleep-related deaths. And they tell us that there is a disparity. These drivers encourage us time and time again. They give us similarities to understand. They require systemic solutions.
Absolutely, they do. And over the past 10 years, we have made some progress in a lot of different areas. So if you take a look at the Ohio Pregnancy Assessment Survey, you'll see that in 2023, 92% of women received a healthcare visit in the 12 months before they got pregnant. That's up from 72% in 2016. We've also seen expansion in home visiting access, where 11% of pregnant people received these services in 2023 compared to just 6% in 2016. Also, if we look at our vital stats data, we see that 72% of women receive first trimester prenatal care compared to 67% in 2014. We've also seen significant drops in smoking during pregnancy, where just under 4% of people are smoking during pregnancy in 2023 compared to 12% a decade ago. We're also seeing drops in teen births. Right now, we're at, I think, just a little over 3% of births go to this population compared to 6% back in 2014. And these wins are definitely worth celebrating. But we definitely have more work that needs to be done, right? Preterm birth rates are still the same. Unintended pregnancies are still the same. Housing stability during pregnancy is still the same. And we still see persistent racial disparities across all of these metrics. And so while we've made some significant changes, we've moved the needle, we still have plenty of work that needs to be done. And these drivers of infant mortality, they do remain, but so too does our commitment to addressing them.
And so if there's nothing else you take from this, there's one thing I want you to hear, is that these problems require systemic solutions. They are not problems that we can treat in a one-off way. And this weight is much too difficult for one single organization to hold all by itself. And that is really why the collective impact model supports this type of work. I liken it to the sun. If you think about the sun, it has a number of important features. It keeps us from freezing on the face of the planet. So that's its most important feature. Keeps us warm. It grows our food. It provides us light. And it resets our circadian rhythm so we can sleep and wake at the same time. And those are all really important things. We want the sun to keep doing those things. But what if we needed the sun to do something very, very specific in addition to those things? What if we needed the sun to burn a hole through a rope? What kind of tool would we use to get that to happen? Yes, I was worried someone was going to say a lighter. A magnifying glass. And that is the goal behind collective impact, is to be that magnifying glass for our community. If you think about it, we have all of the resources that we need in this community to get this done. We have 4 major hospital systems. We've got a number of colleges and universities. We have a generous corporate environment. And the last I checked, which was last night, the Human Service Chamber boasts 210 health and human service organizations as their membership. And that's not all the organizations, that's just their membership. So we have a huge number of people who care in this community. And they are all working hard, and they are warming us in very much the same way that the sun warms us. They are keeping this community warm. And we have this very, very specific thing that we need to accomplish. And so the role of CelebrateOne is to help focus this work so that these organizations, these 210, can continue to serve housing, can continue to serve, you'll actually get to meet some of them today, continue to do what they do best, and make sure that some of their rays are doing the very specific work of saving our babies. So we know what we need to do, right? We've covered that. We need to make sure to coordinate supports for families and across the system. We need to improve prenatal care, access and quality. We need to improve preconception health. We need to make sure that we advance community-based strategies to reduce sleep-related deaths. And we need to do all of that through an equity lens. So we've covered that, right? Got that? All right. We've talked a little bit about how we do it, that magnifying glass. But let's now talk about what those rays of light look like coming through the other end of that magnifying glass. Collective impacts all have a similarity about them, and CelebrateOne is no different. We have the responsibility of facilitating shared data so that we all start from the same information, have the same level of understanding. We have the responsibility to build the capacity of the network, of the systems that our families are serving. I like to call it enriching the soil. We are responsible for building coalitions that care. You here are among them, and that should reach even farther. We are responsible for cultivating a shared message so that we each approach this work with the same lens and can expect to send the same message to our partners. And because this is our full focus, we can do it with sustained support. We can do it with sustained effort. It's really tough for one single organization to pull that off, and that's why we need all of us. One single organization trying to do this is small, mighty, and covers a certain area, but there are opportunities for gaps in between, and that is where your collective impacts can fill those gaps.
Now, collective impact work is hard. I think we all know that. We've been at this for a long time. But by definition, we don't do this alone, right? We're a collective. We have all of you. And so over the past 10 years of service, we've engaged so many different partners. We've engaged partners that span local healthcare organizations, social service agencies, community leaders, and residents as everyday experts. We've forged relationships with faith leaders and community organizers and political champions, fraternal organizations, barbershops, beauty salons, you name it. We've engaged lots of different entities in this space, not just to raise awareness, but so all of you can help us dismantle these systems. You can help us improve our processes and improve the resources that are available for all of our infants in our community to thrive. In our time, we've identified the neighborhoods with the highest infant mortality rates, and we've engaged residents in each of these areas so they can tell us what we need to do to address this problem. We've established our esteemed connector corps, many of which are in the back today.
Wave your hand.
These are residents of our neighborhoods who have been trained as community health workers and employed as trusted messengers and connections to critical resources and information. And today, they have served thousands of families. We've distributed countless diapers, wipes, sleep sacks, car seats, pregnancy tests. And so many of our partners, many of which were named lead entities by the original task force in 2014, have done amazing work. They have distributed thousands of cribs and trained so many parents, grandparents, caregivers, and community about the importance of infant safe sleep. They've helped to increase Medicaid enrollment through presumptive eligibility. They've eliminated early elective deliveries before 39 weeks and made same-day contraception more readily available. They are with us every step of the way. They've helped us implement smoke-free housing policies and smoking cessation programming for families, and they continue to help us in lots of different ways, including by improving our care coordination. And we couldn't do this work without you.
So Amanda shared a lot about where we've been. And so let's chat for just a little bit about where we're going. And that requires your help. So I'd like to think about this through the lens of advocate, donate, and support. Let's start with advocate. As I shared before, this is systems level work that requires system level solutions. And so while we are working in our communities, hand in hand with our families, we also need to know what is happening at the other levels of our government and the other levels of our nation. And we need to be using our voices collectively. At this point, Amanda and I are well known around here. People see us coming. When we come to the State House, they're like, oh, those are the baby people. Okay, we need new faces at the State House. And so using your advocacy around legislation, around policy, big P policy, but also those that pertain to what's happening in your organization. What does parental leave look like in your organization? And ways to make things better for families in your circle of influence. If you want to learn more about that work, stay tuned with us. We have a policy conference coming up in July that can help prime the pump for you on what engagement looks like in an advocacy space. The second way that you can be involved is to donate your time, talent, and treasure to the myriad organizations in this city that are working on behalf of infants. You're going to hear about some incredible ones just here in a few minutes, making a plug for you there, but there are tremendous. We cover them often on our social media, but there are many places that you can find these organizations. And finally, through the lens of support. It can be very isolating to be a pregnant person or a young parent. And you don't want the people in your circle to feel that isolation. So what does it look like to make sure that the people around you are okay and to make sure that the soil around them is enriched with what they need? That's what support looks like for individual families. Make sure that you know the signs of perinatal depression and anxiety yourself, and you can identify them in someone else. Make sure that you know what safe sleep environments look like. Make sure that you provide the support someone needs so that they can get a nap. That's very important. And that is what support looks like for families.